Underlying STI causes. The major causes trusted source of STIs are healing your body from herpes and other STDs, sexually transmitted diseases with 17 Dr. Sebi approved herbs 100g each link in the bio below or visit www.veganchoicefoods.com. Bacteria such as chlamydia or syphilis. Viruses such as HPV or HIV. Parasites such as Trichomonas vaginalis. These causes are primarily transmitted through bodily fluids during sexual activity. This includes vaginal, oral, and anal sex. But some can be transmitted from person to person via skin contact, for example, if you touch your partner's genitals with yours. Although anyone can contract an STI, data shows trusted source that young people and men who have sex with men, MSM, are at the greatest risk. Types of STIs. On the whole, an infection is classed as an STI if it's mainly transmitted through sexual contact, trusted source. However, there are a few exceptions. For example, cytomegalovirus, CMV, can be transmitted through sexual activity, but it's not considered an STI trusted source as it can be transmitted in a number of other ways, too. Some STIs are much more common than others. HPV is the most common trusted source STI in the United States, with chlamydia and gonorrhea also heavily reported. Other common STIs include genital herpes, with more than 1 in 6 people trusted source ages 14 to 49 developing it, according to the Centers for Disease Control and Prevention, CDC. Syphilis is much rarer, but there has been a resurgence in cases, trusted source in recent years, primarily among MSM. HIV infections, on the other hand, have greatly declined since the 1980s, with almost 35,000 new cases occurring in the United States in 2019. If treated promptly, most STIs are unlikely to become an STD. However, if left untreated for some time, the risk of an STD becomes greater. Not all STIs can be cured. HPV is one example. Some HPV strains can lead to cancer, so getting regularly screened for abnormal cell changes is key to early diagnosis. STI diagnosis. A doctor or other healthcare professional can perform tests and examinations to help figure out whether you have an STI or a different condition altogether. These may include rapid finger prick tests, fluid samples from the vagina, penis, anus, or any sores that have appeared, blood tests, urine samples, pelvic and physical examinations. It's important to get tested regularly if you are sexually active and to consult a healthcare professional as soon as you develop any symptoms. Early diagnosis means you can get treatment earlier and decrease the risk of complications. STI complications. In some cases, untreated STIs can lead to serious health problems. Trusted source. They can increase the risk of infertility, cause certain types of cancer, make a person more susceptible to contracting HIV, lead to organ damage and even death. Pregnant people should be aware that STIs can affect an unborn baby. Trusted source and the overall pregnancy, too. Some STIs can be passed to the baby before and during birth, potentially leading to infections, pneumonia, meningitis, blindness, deafness, brain damage, stillbirth. Premature labor is also a risk of having an untreated STI. This is further complicated as some treatments may not be safe during pregnancy. A doctor or other healthcare professional will be able to recommend a treatment and delivery plan that will reduce the risk to you and your baby. As some STIs are asymptomatic, all of the above makes it even more important to get screened on a regular basis. STI treatment options. Doctors can treat certain STIs. Trusted source. Chlamydia and trichomoniasis are cured with antibiotics. Gonorrhea can be cured with antibiotics. However, some drug-resistant strains of the bacteria have emerged that don't respond to traditional treatments and may be more difficult to cure. Syphilis can also be cured with antibiotics. The medication your clinician chooses depends on the stage of syphilis. Acute hepatitis B usually doesn't require treatment. If the virus doesn't clear on its own, antiviral medications are used to treat chronic hepatitis B. Some conditions aren't curable, but treatments can help reduce their symptoms. Herpes, HPV, and HIV fall into this category. For herpes, clinicians will prescribe medications known as antivirals to shorten an outbreak. Some people take these medications on a daily basis to help reduce the likelihood of an outbreak. Daily antivirals are also used to treat HIV and stop the virus from replicating in the body. Within 6 months of treatment, the virus will become undetectable in most people. Clinicians don't have specific treatments for genital warts caused by HPV. However, they may prescribe topical medications or perform procedures to help shrink or remove the lesions. Remember that even if you've been treated and no longer have an STI, you can contract the STI again. Tips for STI prevention. The only 100% effective way to prevent STIs is to abstain from any sexual activity. But there are ways, trusted source, to reduce the risk of both contracting an STI and developing complications.